Go.
Hello everybody from Luke's Endodontics. I just want to go over a case presentation here. 62-year-old male who presented with swelling on the lower left-hand side associated with tooth number 19. You can see this mesial buccal root has a periapical radiolucency associated with it. Both these root canals were over 10 years old. Okay, he has a post on the distal, large post on the distal of both 18 and 19. Root canal treated on both of the teeth, and what you can see is an inadequate obturation on both. Okay, we found that only 19 was contributory to the swelling. Go ahead and go to the next slide. This is a 3D image. It's a slice that basically shows us kind of where anatomical landmarks are. For instance, the inferior alveolar nerve, you can see it's kind of right here. Good margin of safety from the nerve to the tooth, which makes surgical considerations an option. So you always want to present the risk and benefits to a patient on what their options are. Go ahead and go to the next slide. And this again shows you a really good appreciation of how big that post is in that distal root. So this is an outline of the root form. And the root kind of has a concavity in the mesial distal direction. Mesial distal direction. In the buccolingual direction, it's much wider. But in this direction, there's not much of a margin of safety. Very high risk of fracturing the tooth if you were to take that post out. Go ahead and go to the next slide. It's just a good image that appreciates kind of that you don't. This is from the beginning, pre-op X-ray, where you don't really have a provider that, and when they did the initial root canal, that they were able to get to the end of that root. So one of the considerations is, how comfortable are you at getting to the end of the root? Okay, so this is all I do every day. But it is something to consider, is what is that filling material, and am I able to get to the end of that root and take that material out, adequately disinfect it. Go ahead and go to the next slide. This is just a picture that we took of 18 to show that the periodontal ligament space is pretty much uniform all the way throughout, that there is not an infection associated with that tooth. Next slide. So we initiated the case. We were able to successfully take out the obturation material and then place the calcium hydroxide, let it wait for about 2 weeks, had the patient come back, resolution of symptoms occurred, patient was happy, everything went uneventful. Next slide. Here we take next slide. We take a master cone shot, showing that we were able to clean to the very end of that root. You can actually already see kind of like a lightening already occurred, maybe in the beginning stages of bone formation. Go to the next slide. And this is just our final, where we sealed it with the bioceramic sealer, placed permaflow at the orifice, temporary restoration, send it back to the dentist for them to go ahead and do a permanent restorative material. Really looking forward to seeing this case in 6 months to a year with complete bone fill. Everybody have a great day.